At this 60th meeting of health ministers from East, Central and Southern Africa Health Community, the theme is based on strengthening regional cooperation for better health outcomes. At the three-day meeting, the delegates will tackle the many challenges facing the region.
Picking the best practices in the region and sometimes beyond, we are likely to meet our challenges at a faster and a more effective rate.
Uganda's Prime Minister Dr. Ruhakana Rugunda, who opened the conference, cited the Ebola epidemic, which has ravaged West Africa for over 1 year now.
Disastrous as it was, demonstrated clearly when there is a problem and we unite and respond effectively, then that problem can easily be contained. But of course, it also gives us another important lesson, that we should never wait.
We have talents and skills in our continent, and we need to mobilize them.
The regional health officials were unanimous that effective service delivery remains the core to the citizens. Speaking for the World Health Organization's Africa Regional Office, Dr. Alemu, Uganda's country representative, said effective service delivery is vital in achieving health development goals in the post-2015 agenda.
Responsibility mainly is on government to urgently and significantly scale up efforts towards universal access to affordable and quality healthcare services.
But critical to achieving universal healthcare is a committed healthcare workforce. Yet this remains a huge challenge for the region. In Uganda's case, government has been sued for seeking to export doctors abroad, yet the local demand remains woefully unmet.
Government is doing everything possible to improve conditions for health workers. Of course, you know that there are some doctors and nurses who have not been able to be taken on. Those are obviously at liberty to ensure that they get a livelihood in the region or beyond.
The delegates also agreed on involving other stakeholders in bringing down the disease burden, especially HIV.
There was a study from Cornell University which showed that if you looked at viral loads of people before treatment, the viral load in East and Southern Africa, excluding South Africa, was 5.5 times the off-treatment viral load in the USA and North Africa.
Governments were urged to show political commitment at regional and local levels to tackle the challenges. Sustainable health financing also remains a huge challenge, with each country moving at its own pace. The ECSA Health Community Cooperation encourages peer learning, with countries learning from others.
We have passed the HIV/AIDS Prevention and Control Bill. Part of it includes the HIV/AIDS Trust Fund. But we went to Zimbabwe to learn how the trust fund can be run.
The ECSA region has also celebrated 40 years of health service delivery to citizens in the 9 member countries. Florence Nalimba, NTV.